Allowable sharing of behavioral health notes, June 10, 2022. An educational presentation brought to you by the Hawaii Health Information Exchange. This material is presented for educational purposes only, and is not intended to be a solicitation for services or legal advice. The purpose of this presentation is to provide an explanation of the types of behavioral health notes and under what circumstances they may be exchanged or shared. There are two types of behavioral health notes: progress notes and process notes, also called psychotherapy notes or private notes. Progress notes. Progress notes are part of a medical record, or designated record set, and are included in the definition of electronic health information, EHI. They may be disclosed without patient consent under HIPAA. They must be disclosed as EHI in certain circumstances under the 21st Century Cures Act information blocking rule. Process or psychotherapy notes. Process notes must be stored separate from a medical record. They may not be disclosed without explicit patient consent, or by court order. Progress notes are basic records that establish the progress of treatment and communicate treatment plans, medical history, and other vital information. Progress notes are part of a medical record, and may be shared without explicit patient consent. Use and disclosure of them is covered by treatment, payment and healthcare operations under HIPAA. Progress notes usually follow a standardized format, such as SOAP, subjective, objective, assessment, and plan, or DAP, data, assessment, and plan. HIPAA states that progress notes may include assessment and diagnosis, treatment modality and frequency, session start-stop times, topics discussed, interventions, medication monitoring, test results, summaries of functioning, symptoms, prognosis, and progress. Progress notes may be written by both physicians and nurses to document patient care. Process notes, also referred to as psychotherapy notes or private notes, document or analyze contents of conversation during a private counseling session. Some psychotherapists believe that it is now not standard practice to keep process notes. Process notes often include the mental health provider's private notes and may include observations or thoughts, personal impressions about patients, hypotheses about a patient's situation. These notes must be stored separate from medical records or protections will be lost. Storing psychotherapy notes in medical records is out of compliance with HIPAA. If process notes are maintained in the EHR, they must be maintained separately from medical records. Providers should talk to their EHR vendors to ensure this is happening if they have process notes in their EHR. Process notes may be created by a healthcare provider who is a mental health professional. Disclosures may be made when required by law, such as for mandatory reporting of abuse, and mandatory duty to warn situations regarding threats of serious and imminent harm made by the patient. Unlike other protected health information, a healthcare provider may deny a patient or their personal representative access to psychotherapy notes. HIPAA's privacy rule governs how protected health information, PHI, may be used or disclosed. For more information on the privacy rule, see HHIE's presentation, HIPAA Part 1, Overview of Privacy Rule and Hawaii Harmonization Act. Use and disclosure of progress notes is treated the same as other PHI under HIPAA and may be disclosed to other covered entities for treatment, payment, and healthcare operations, TPO. Other disclosures may be allowed with explicit patient consent, but you should note that certain alcohol and drug abuse treatment program records are specially protected from exchange under SAMHSA's 42 CFR Part 2 regulations. Process notes are specially protected under HIPAA. They are not permitted to be exchanged without patient authorization, given that process notes are excluded under TPO. This means you may not disclose process notes to other healthcare providers without patient authorization. Under HIPAA, providers have the right to refuse a request by a patient to see process notes taken during their own treatment sessions. This is the only element of PHI that may be handled this way. HHIE does not permit the exchange of psychotherapy notes or records protected under 42 CFR Part 2 through its Health Information Exchange System. The 21st Century Cures Act Information Blocking Rule applies to progress and process notes. Progress notes are required to be shared in accordance with ONC's Information Blocking Rule. Progress notes are included in the definition of electronic health information, EHI, since they are stored in a medical record, also known as a designated record set. Hospitals and other providers have historically been hesitant to exchange progress notes because of the potential risk of an inadvertent disclosure of process notes. This did not necessarily cause a conflict with HIPAA, but does under the information blocking rule since this information is part of a designated record set. Process or psychotherapy notes are not required to be shared under the information blocking rule. Process notes are excluded from the definition of electronic health information. Because of information blocking considerations, hospitals and providers should re-examine their policies with respect to behavioral health notes to ensure that they are meeting the requirements of both HIPAA and the information blocking rule. The following are examples of additional sources of information on the topic of behavioral health progress and process, or psychotherapy, notes. The list is not exhaustive and is provided for illustrative purposes only. This is the end of the presentation. Thank you for your attendance. Please contact us at the Hawaii Health Information Exchange should you have any questions or suggestions for additional topics.